Is sourcing and quality control the biggest issue?
So I find that it's two problems. One is that the FDA makes it so impossible that people do kind of go into the gray area and just try to find a way to get out there. And there's also, because it is so hard to get into, it attracts a lot of snake oil salesmen and a lot of people that are chasing money. And so all they really care about is, can I turn this around? Can I sell it and make a quick buck? And what are my profit margins? And they don't actually care about the final product.
What are you seeing in the market today, and what have you seen in terms of public safety alerts being popped up over time?
You know, I'll try to stay away from specific people, but there are a lot of counterfeit products that are brought in. There's a lot of low quality products.
I have a quick favor to ask before we start. I'm not even asking 30 seconds of your time. If you have been enjoying the 90% Healthy podcast, which truly appreciate if you hit subscribe, it genuinely helps us grow and reach more people and keep bringing you thoughtful conversations about health that actually move the needle without losing your mind. We're really, really grateful that you're here and continue to be. Now let's jump in the episode.
Welcome back to the 90% Healthy podcast. I'm your co-host Claudia, and hey Don, right here.
Hey Claudia, we're back again. We're doing a couple this week, so because you're going on vacation and we got to get
work.
So
A little bit of a combo of both.
It won't be this week because we'll post it a couple weeks from now. But
yes, but you guys, this is an episode that you want to listen all the way through because we are talking about stem cells and all the things that is wrong with how the marketplace is set up at the moment across the United States and probably beyond. And we have a guest who really opened my eyes to a lot of the conversations that are happening in stem cells. Jeff Turk, welcome.
Thank you.
Tuning in
Nice
from
to be here.
Costa Rica.
yeah, and I'm excited to do this because I'll tell you, having been in this, not just the human performance space, but also the longevity space, stem cells, that's all you hear about. And as someone who's been around medicine for a long time, you know, I'm watching these people go in and get every joint facet injected. And I don't think people see the result of that. They just think, oh, everything's great. There's some real issues. There's a reason why you can't get certain things done in this country. So I'm excited to be talking about this today.
Yes.
I'm happy to
Jeff,
be here, so thank you guys for having me. I appreciate it.
Well, thank you. I want to start with a little bit of background with you. We'll keep it brief because we have a lot to cover, but I think I would like our audience to know what brought you into this space, because you've been tinkering with this for a little bit.
Yeah, you know, it's interesting. So I live in Costa Rica. A lot of people know that kind of Costa Rica was a hub for stem cells, right? Neil Reardon, who kind of started this in Panama, originally started in Costa Rica. And so one of my closest friends had the first legal stem cell facility here in Costa Rica. So just being a nerd and loving science, I read clinical trials for fun ever since I was a kid. And so just being around it all the time on a day in and day out. And then I had a marketing agency. So I started marketing for it many years ago and just realized there was a need to kind of get this, you know, I'm a disabled veteran myself. And so the only thing that really helped me was actually stem cells. And so that's kind of why I decided to get into it, to help share healing with other people, right? It's something people should have access to.
And I love you mentioned share healing because this is what you set out to do, yet the stem cell market has turned into something, a rather different profit avenue for a lot of people where the priorities have shifted. What are you seeing in the market today, and what have you seen in terms of public safety alerts being popped up over time?
You know, I'll try to stay away from specific people, but there are a lot of counterfeit products that are brought in. There's a lot of low quality products. There are products that are being imported from other countries that are not following U.S. safety regulations, products coming in from Colombia, products coming in from Mexico, a lot of these other countries. And you know, it was the disappointing part about getting, you know, in and around, say, the medical space, was realizing that a huge percentage of the people involved in this are more concerned with money than they are with healing.
You know, that's one of the challenges that you have, is that, I had a little bit of a background in my brother was a doctor of veterinary medicine. We lost him about 5 years ago, but he
Sorry.
was very early on using stem cells and biologics in his veterinary practice because the FDA had pretty much taken the reins off veterinarians because they want to learn as much as they could. And my brother loved using these products. He was a surgeon and he loved using this. And he says, listen, once this stuff really gets into human, it's going to be a big deal. So you start to see that it starts to leak in and that you have some pretty good doctors that are doing pretty good work that gets a little bit of success. But then all of a sudden you start to see this flood of, again, the person who's just trying to take advantage of the situation, because these processes are not inexpensive for the patient, which
And
means
that's
there's a lot
actually
of profit to the practitioner.
that was what got me into this, is because, as I'm a retired government employee, right, and a disabled veteran, and these treatments haven't changed for the last 12 years or so. They've maintained around $25,000 for a treatment for like a full,
Mm.
say, 100 million dose treatment, and that is starting to come down with certain places. But part of the way that they start driving those prices down is by diluting basically the product, right? And so there is there is a large amount of that going on in the industry where we can delve into it later, but where people are more concerned with how many cells I'm getting than what are the quality of the cells, for example.
Yeah, so let's start to roll into this. Let's kind of do a stem cell 101 for our
Yes.
audience on this. And if you don't mind, Jeff, let's walk our listeners through, why would someone consider stem cell or other biologic therapy?
So, most of my experience comes from international, right? And so I'll speak from what I've seen at the clinics going on internationally mostly. And I think, there are a lot of like you said, there's some doctors that are very pro stem cell, right? Because they know that it's good for the patient. A lot of other doctors realize that it's also going to put them out of work. So something that I've seen quite a bit is, say, rotator cuff injuries, right?
Mhm.
A lot of people would usually need surgery for these, and instead they can just go do an injection in their shoulder, a lot of knees, pretty much any of your conditions that are autoimmune related or inflammatory related. Because one of the things that stem cells do is they modulate the immune system, so they can actually reset it. So whenever you have an autoimmune, it's attacking yourself, right? And so you want to stop that. And part of the way that you can do that from stem cells is by resetting that immune system or just signaling the body to heal, because I think that's the big thing that people don't understand. For years they thought the stem cell itself was actually doing the healing. So if I put the stem cells in my shoulder, the stem cells themselves are actually doing the healing. What they found is that about 80% of the healing, so the vast majority of the healing, is not done from the cells themselves that you're putting in. It's done from the signaling of the cells of your own tissues to tell your own tissue to start healing. So why they would
Well,
want it? Anytime you need to speed up healing, basically.
so it's not a huge leap to sit back and say, for instance, I've had 8 knee surgeries. Okay. And my daughter just had a rather significant, she had bilateral patellar tendon ruptures and she had to have them repaired. And I don't think it's out of the question that when you have a surgery like that, to go get some of your plasma, spin it down, get some of these healing factors and inject them directly into the wound upon reconstruction. That doesn't seem like a big, like a leap for me. It seems to make a lot of sense. Does it? Does that make sense to you?
It does, but you're talking about different things. One, the plasma that's coming from your own blood, it's called PRP, so platelet rich
Mhm.
plasma. It does work really well, and you are concentrating down, right? We all have exosomes and stem cells floating throughout our blood, so it does have a very beneficial. A lot of people get a huge benefit from that. The problem starts to come in when you get older. So say around 45 years old, everybody's different, right? We're just biologic creatures, just like all trees are a little different, right? So it really
Mhm.
does depend on the person, how healthy they are. But you have to remember, once you get to around 45, 50 years old, you're concentrating the negative as well as the positive things. So PRP tends to work better when people are a little younger, unless they take really good care of their health. Because if you have a lot of inflammation in your body, then you're also concentrating those inflammatory markers inside of the PRP as well. Does that
Okay,
make
that
sense?
makes sense. Yeah.
Yeah. And
So
then I was just curious, and then when it comes to stem cells, we see these 3-letter acronyms thrown around in the industry, and I think a lot of people can't have a hard time making sense of them. What comes from what matters,
yeah.
which one is better for? Can you help explain what we're talking about and what is most common in clinical practice?
It's really confusing if you come in, right? It is very similar. People think a stem cell's a stem cell. Oh, I got a stem cell, right? So there are a lot of it's kind of like saying I got a transport. Well, it could be a bicycle or it could be a jet, right? And I might make up a few analogies while we're here. Hopefully that they flow well. But so when you look at it, first off, most of the industry that say in cosmetic space, right? They're talking about plant exosomes or other animal exosomes. And the same way I can't read a book in Chinese because I don't speak Chinese, your body can't read the instruction manual of a plant stem cell or another animal stem cell. So you just don't have the ability to read that. There's still some benefit. You're still getting some proteins and other beneficial things in it. And then, so you have to separate other non-human stem cell and exosome products, right? A lot of people are just jumping on the bandwagon of because they know, hey, stem cell is a hot buzzword, exosome is a hot buzzword, right? Then when you get into the real stem cells, right, you can get it from bone marrow aspirate, right? So you get it from the bone, you can get it from adipose, so you can get it from fat. You can get it from your own blood where you can pull it out and spin it. Those are all called autologous. They come from you. And then you have some allogeneic sources, right? Those are the ones that you hear about: umbilical cord blood, umbilical cord tissue. Those did not come from you. Those came from an external source. So, yeah.
So before we go too far, we've already introduced a new term here that I want our audience to understand. So we've talked about stem cells and we talked about exosomes. Let's talk about the relationship between exosomes and stem cells before we really go much
Sure.
deeper in this.
So it's really simple. If you think about the stem cell is a manufacturing plant, right? That's all it is it's a manufacturer. And there's approximately about 1,000 to 1 size difference. So an exosome would be 1,000th the size of the stem cell. Stem cells, MSCs, mesenchymal or mesenchymal, a lot of people say. So the guy that actually discovered them stopped calling them mesenchymal cells and started calling them medicinal signaling cells. Okay. And it's because he realized later on that really what they're doing is they're factories for signal. Okay. And everybody talks about exosomes. Almost nobody actually has pure exosomes. What they're really doing is they're concentrating all of the things that stem cell is producing. Exosomes being one of the most powerful, but there's also growth factors in there. There's proteins, there's cytokines, there's chemokines. So you're actually bringing all of that in a huge soup. And that is what the majority of these products are, whether it's amniotic fluid. You'll hear a lot about Wharton's jelly. These are a mixture of a whole lot of other things, even though they call it exosomes or they call it stem cells, right? Usually there's some other things involved.
So
Is it possible, Jeff, to actually isolate the exosomes by themselves, or is it you have to get the soup, or can we get the exosomes?
You can actually isolate them. Exosomes are between 30 and 150 nanometers. So you can exclude all the sizes outside of there and get a pure population. But
Okay.
what most of the studies and trials have shown is that all of those other factors in there are actually very good, assuming that the stem cell, remember, their direct relation to the exosomes in that soup is a direct relation to how healthy the parent cell is. So if you have a young, healthy stem cell, then you're going to have younger and healthier exosomes and growth factors and proteins in there as well.
So, if I understand it correctly, and please correct me if I'm wrong, and just to help reiterate what you just
No.
said in terms of exosomes, they are the messengers that tell your cells what to do. So, the stem cells are manufacturers, they are bringing these exosomes into your body, and then the exosomes are what whip your cells around to get to work and begin to regenerate, right?
So a good way to think about it is an instruction manual, right? And so the exosomes are basically an instruction manual. All they do is carry cargo, right? An mRNA inside of there. The mRNA, if you think about it as an instruction manual for your cells. So when you have young, healthy stem cells, they're going to produce very young, healthy messaging from those exosomes. When you put those into an older body or around older cells, the older cells will take up those exosomes and then they will start acting like a younger version. And so it's not always a one-time hits, because when your stem cells, Claudia, I'm sure you're a young woman. If your stem cells take these, they become even younger. But then your stem cells, there's something called paracrine signaling. And all that means is they're signaling all the people around them, all the cells around them. You then have autocrine signaling. That just means that the stem cell is producing those exosomes, and then it's taking back the same exosomes that it's producing. And then the other one is endocrine signaling. So as the stem cell produces exosomes, they're going throughout your body, and then they're getting absorbed by different areas in your body. So all three of those contribute to signaling the surrounding tissue, but then also the tissue in the body, in order to start acting like a younger version of itself. And that's why you can get increased healing. You can get more youthfulness out of your cells, is because there's a copy of every year that you've ever been alive, every day you've ever been alive. Everything is inside of your cell. So you're just telling the cell to act like a younger version of itself. That's why the signaling is so important, and where the cells came from and how healthy they are.
What are some of the most frequently used ones in the industry when it comes to stem cells? I see there are some places where like, oh, extract my own adipose tissue stem cells, or give me umbilical cord. But then, like you said, if you're using somebody else's, you're getting somebody else's baggage in addition to healing factors potentially. How is it regulated?
So the very first, my grandfather was the first person that was treated at my friend's clinic here in Costa Rica, right? And we used his bone marrow, and he wasn't able to sleep lying down for 13 years. And 10 days later was able to sleep lying down again for the first time, right? And so I ended up doing adipose, so out of my fat. So I asked him to suck out a little bit more, make me look a little more beautiful. He didn't do that. But, you know, when he injected that into my knees, it had very little impact, very, very little impact. It doesn't mean that it can't work, right? But maybe kind of like using an old cell phone charger. Will it charge your phone? Yeah, it will, maybe real slowly, but nowhere near at the speed and the power of, say, a newer, more powerful charger, right? And so you have bone marrow aspirate, where they pull out of your own bone marrow, adipose tissue, again, fat. But each one of those, you're going to have very low quantities of stem cells in there. So that's really part of it, is you're not getting that signaling of younger cells, right? And you're also just not getting enough quantity. Think about it like a construction site. If you throw 5 guys on the site, how old are those guys? It's very important, right? 5 guys might be able to do more work than 20 guys if they're much younger, healthier, and stronger. Stem cells are the same way. So there is a quantity, but then there's also a quality, meaning the quality of the signal that the cells put out, if that makes sense.
Yeah.
Yeah.
And that quantity issue brings up a fundamental difference between having procedures done in the US versus having procedures done overseas. That if I go to Costa Rica and I have stem cells extracted, those stem cells can be multiplied. They can go into a dish and they can be multiplied and grown. And if you do that in the United States, that's a process that's governed by the FDA. It becomes essentially a drug at that point. Whereas if we go get stem cells either from placental or umbilical cord or things like that, those are tissues. That's like a heart transplant or a kidney transplant. It's a tissue transplant, and this is done which is governed by another agency. But that agency says, yes, you can implant these cells, but you cannot multiply them. Is that the correct interpretation of this, Jeff?
So the way that the FDA writes this is there's something called, and I won't go into too many details, but it's called HCTP 361, human cell therapies, right?
Okay.
And so what they allow for is what's called homologous use, which means that it is used for the same purpose in the body. And it's all a game, right? These are shades of gray right now. Thankfully, states like Florida have opened it up for any of the perinatal tissue to be used. But the FDA has made it very difficult. I mean, I know people that have spent tens of millions of dollars to try to get a clinical trial, and they're only at phase 2, right? So they have restricted it to making it extremely, extremely costly in order to even start trying to use it in the US. But when you're using, say, Wharton's jelly, what a lot of people call Wharton's jelly, right? Like,
Explain, please.
yes. So
What
I'm
is
not
that?
going to name drop on anybody in particular, but Wharton's jelly, what it is it's the cushion inside of an umbilical cord. So inside of there, you do have some stem cells, but mostly it's collagen, right? And basically like a hyaluronic acid. So what they do is they say this is a cushion for the cord. We can then use this for homologous use, and we can inject it, say, into a knee, right? And then it's being used as cushion for the knee. When everybody knows the reality is that you're using it for the signaling that's inside of there, for the stem cells. But in the case of I would say every company but one that I know of, if they're not using a cryopreservative in their Wharton's jelly, then the stem cells are almost all dead,
They're
99%
all
dead.
dead. Yes. I
They're-
think that's the important point.
yeah. And then the other important point, Don, is that, there's a couple of companies that are calling it Wharton's jelly when the reality is that it is almost 99% amniotic fluid. And so they're telling you it's Wharton's jelly, but it's really just amniotic fluid. And they're using that in order to hide, because you can only pull a few milliliters from umbilical cord of Wharton's jelly, but you can pull hundreds of milliliters from amniotic fluid. So what they'll do is they will then say they're 400 milliliters from amniotic fluid. They'll divide those 3 or 4 milliliters of Wharton's jelly amongst 400 vials that they're calling Wharton's jelly. But the reality is it's almost all amniotic fluid.
And is this being done under the direction of the FDA or not?
So the FDA just can't really keep up. This is my understanding, right? I don't work for the FDA, just so we're clear. And by the way, I am not a doctor or a scientist. That's always my disclaimer. Hopefully I got it in here good enough. So I don't give medical advice, but the FDA can't keep up. As of about 4 years ago, just in Florida, there were like 326 unlicensed stem cell facilities just in Florida. And that was before they legalized it, right? So it's, the FDA generally covers what you're able to say, and they don't go after anybody unless they either hurt somebody or they're doing deceptive marketing, saying, hey, even let's just assume that stem cells can help fix rheumatoid arthritis, right? And I'm in Costa Rica. My mother-in-law injected herself with some exosomes here, and it definitely does help with rheumatoid arthritis, right? In the US, you cannot market that. You cannot say this product will help reduce pain from rheumatoid arthritis, because then the FDA will come and say, okay, show us your clinical trials where you've proven that. Right. And
it only takes 2 trials for the FDA to give approval on that. The barrier for entry on this is pretty low, and they still haven't gotten there yet.
Well, the barrier of entry goes into, you're going to spend, it's millions of dollars by the time you actually get fully developed to market, right? This is one of the things that disappointed me when I got in this industry. From discovery to market is on average 18 years. So if you're trying to get something FDA approved, it could take you, and could meaning like averages here, 20 years, and you might spend close to $1 billion to get fully approved. And so the problem in this industry is that you cannot patent a natural biologic, just like you can't go patent the leaf of a tree, right? And so
Right.
if you have a product, who's going to spend that amount of money to push through a clinical trial for a product that they can't patent?
That's
There's no
interesting.
money in it.
But
Yeah.
what they have done, what we do know, and listen, I'm not, you know, I'm not here to advocate for the FDA, how it works. I think there's certainly issues with that. But at the same time, we've got some clinics that are doing some stuff that's pretty shady,
100%.
and someone needs to come down on them. And I think, what got me interested in this topic today was you're one of the first people that have stepped up and said, hey, there's some real problems with
Yeah.
this stem cell business. And so, as we work our way through that, this is something you got to keep in mind. So your point is that is sourcing and quality control the biggest issue?
The biggest issue. I would say there's two main issues. And yeah, thank you guys, by the way, for having me on the podcast. This is my first podcast. And that is exactly the reason I decided to come out and talk about this, because nobody wants to address it because there's so much money and nobody wants to. Just a real quick background is I actually got into this and being around it because my friend had a clinic and they were actually treating people, right? And I switched to cosmetics because you can still do great things for people and you can still heal. And I just could, the regulatory side in the US was just basically impossible to navigate. You know, I wasn't born with a silver spoon. I don't have tens of millions of dollars or hundreds of millions in the bank in order to do this. So I pivoted to cosmetics. And so in a lot of ways, I don't have a dog in this fight, but because I know how to do some of the top manufacturing in the world, and I know the industry. I went around this and I looked at what everybody had and what was best for what, just so I could understand as somebody, you know, a lot of people come up in this. The patients that I've talked to in the past know more than the doctors. It's really kind of crazy because they've done much more of a deep dive into these things than their doctors have. And I've just been blessed to having traveled around and talked to a lot of doctors that are very, very good. So I find that it's two problems. One, there really is a lot of curative aspects to stem cells and exosomes, right? And in fact, they're finding out that it's more about the exosomes than even the stem cells. You don't really need the stem cells, right? And so one is that the FDA makes it so impossible that people do kind of go into the gray area and just try to find a way to get out there. And maybe also, like, you know, what would be considered standard drugs. There's also, because it is so hard to get into, it attracts a lot of snake oil salesmen and a lot of people that are chasing money. And so all they really care about is, can I turn this around? Can I sell it and make a quick buck? And what are my profit margins? And they don't actually care about the final product, right? I mean, this started out with me having treated almost everybody in my family. And I just said, this needs to get out to the world, right? My mom's been treated. My fiance has been treated. Grandfather is treated. Myself multiple times, right? I've probably taken more exosomes and stem cells than anybody you've spoken with before, I should say. And so it is both, right? That's why I think it's very good what RFK is doing right now, right? He's opening up the industry, but he's doing it in a safe way, right? He's saying, do the testing on yourselves. Make sure that the final product is clean. It doesn't have endotoxins, doesn't have mycoplasma. You're doing your sterility testing, right? Make sure that what you're putting out is clean. And so they lifted some of the regulations for doing an IND where you don't have to have, say, a full CGMP certified laboratory, which can cost you a few $1 million a year just to maintain. So to answer your question, I think it's both, right? It's because they created an environment that was almost impossible to get into, and people do want to have access to this. And then that also attracted a bunch of bad actors, way more than I thought, to be honest with you.
So that's really the challenge that we have right now, is that we have standards in place in order to protect the public.
Yeah.
Those standards can be difficult, and sometimes they can be extreme.
Yeah.
We do know there's things that, and the FDA and government agencies do create experimental use scenarios. Florida is one of those places. There's a lot going on in Florida right now. But as someone who used to work with doctors in Florida, I'll tell you, I would go in and visit I met some of the most brilliant doctors I've ever met in my life in Florida. There's one down in Miami. There's one up in St. Petersburg. These women are phenomenal. But there's also been a group of doctors down there. When I leave their office, I want to go take a shower because they're such scumbags. And there's nothing that stops. Listen, they've got their door open. They'll take your money, whether it's for a cannabis card or to help you get some kind of paperwork for disability or something like that. It sounds to me like stem cells has now made their way into these environments, and you're not sure where you're getting the product that you're being treated with. And that's what's led to these warnings, because people have gotten very ill from these treatments.
Yeah.
Which is what I wanted to talk about next. I would love
Yeah.
to
Yeah,
see what you've seen.
I'll just say this. You're right. I've worked with some amazing doctors, met some amazing doctors in my journeys that are really good. You know, a lot of people ask me to be on calls with them when they're talking to a doctor, so that, you know, just because I know kind of a lot of the skeletons and what's going on. And, you know, I'll never forget this. There was one doctor that was willing to use certain stem cell products for himself and his family, and then was using a cheaper product on his patients.
Oh,
And that was really disappointing to me,
oh,
right? It
that's
was really
terrible.
disappointing to me. Because one made him more money. And that's the other thing is doctors, the industry, and then we'll jump back to Claudia. The industry, unfortunately, seems to me to be one of doctors have been so trained by big pharma to here's your pill, go do this, and not to ask questions. Where's the pill made? What does it do? Right? Is it better than other? Is this generic? Because so they don't do that in the stem cell space. They don't even know what to ask for or what to look at. So in some doctors' defenses, they've been trained by the pharmaceutical space. If you're getting vitamin C in an IV, you're not like, okay, let me see the lab analysis of where this vitamin C came from. You trust your provider that they did their work and that they're selling you good quality vitamin C, for example.
But
Yeah.
with stem cells, it's not always the case.
That is correct.
Well, no, and I'll tell you, if the listener wants to understand where this comes from, there's a great book that was written a few years ago by Dr. Robert Lustig. It's called Metabolical, and it's about this three-headed big pharma, big medical, and big insurance, and it's created a challenging environment. Out of that environment, we're starting to see a more entrepreneurial approach of functional medicine, people coming out. But this has been the theme of the podcast, that while you have some people coming out of this that are just brilliant and they're wonderful practitioners, they're scumbags too.
Yeah.
And they may not have scumbag on their name tag. Okay. So you've got to figure out
Unlikely.
how you can determine this. Am I dealing with someone who's legitimate, or am I dealing with a scumbag that's willing to give a
Yeah.
second-rate product to his patients where he wouldn't give it to his family or
And I,
her?
and I think that is where the one of the places where I feel like I can help not only the doctors that do genuinely care and want to help, right? I don't want to bash all doctors. I think, a lot of them got in there to genuinely help heal people, but they don't even know what to look for, which is why I've spoken to a few doctors. But then also it's incumbent on the patient, in my opinion, to know, right? I mean, somehow doing your own investigation was a dirty word during COVID, right? And it's like, do some research for yourself. This is what you're allowing somebody to put into your body. Ask questions, right? What are some of the questions? That is what I'm hoping to help people with, is what are the proper questions to ask
Yes.
your doctor, right? Because and have them provide this. And if your doctor doesn't know it, and if the person selling him a product doesn't have the answers to these things, then and there's cause for concern, right? Just like,
Then you should get a new doctor.
Probably.
yeah, or get a different doctor, right? Because some doctors are like, oh, it works, right? But again, I would compare it back to the cell phone cable, right? Yeah, it works. It'll charge your phone in 12 hours, right? Does it work? It's kind of like a watered down version of it that'll work, right? And unfortunately, just like a lot of humans don't understand that some chargers will actually charge their phones a little better. Some patients don't know that or even doctors, that there's better quality products out there that are just going to work a lot better too. So it's important. It's important to look at purity. I'm sure we're probably going to jump into this, some of the things that would be good to look at, right?
Yes, I would love to see what are the questions that we need to be asking, as whether we are a patient or a doctor, to know the quality checks out
Yeah.
and potency and all of that.
So there's I won't name drop with anybody, but Claudia, I think you know the person, very, very well known in the exosome space, a doctor that I spoke with recently. And I was explaining replications, how many replications, and how the age of the cell is very relative to the strength and the quality of
Right.
the product that comes out, right? And he mentioned to me that he had thought it was a little curious that the company he'd been buying exosomes from had the same lot number for almost 2 years,
Mm.
right? And so what happens is some of these companies have what's called an IND, and then they pretend like that's legal to sell it to everybody because they have permission from big pharma for a specific clinical trial, right? They have permission to try and use this product on specific conditions.
What
And
does IND stand for? I want to make sure.
investigational new drug is what it
Okay.
stands for, right? And so you would get in, which is a permission to say, just for example, use exosomes for rheumatoid arthritis. So typically that is, allowed to be used in 20 patients, say, right? Then what they do is they say, well, we're legal and we have this permission. And then they go to all the doctors and they say, we have an IND, so now it's legal for you to use our product, right? Which is not the case. It's not true. And so what they do is cells age the same way a human being ages, right? Every day, every year, we get a little bit older. Cells are the same way. When you file an IND, you're filing on a specific cell line. So specific stem cells that came from a specific cord from a specific person, right? You have to do all these checks. There's a lot of analysis that has to be done in order to certify that cell line. Now, you're not FDA approved, but it is authorized to use that for a trial, basically, an IND. And so what they'll do is they'll take that cell and they'll grow that cell. Okay. When you grow a cell, just like the way a person ages, a cell has population doublings, or replications, how many times it's divided and doubled, right? As that cell divides, there's a point at which it starts getting old and tired, right? It's replicated enough time. As it's replicated, then you start getting what are called senescent markers. So it's just the cell will start saying, hey, I'm old. Really, right? P16, P21, a couple of these other senescence related markers. And so if you continue to grow cells even after, so there's a direct inverse relationship between the anti-inflammatory, the really beneficial things in here, and then the pro-death, the pro-inflammatory. So not good. So they start doing this, right? The older a cell gets. So ideally, that's why you can have certain cells or certain exosome products that will not have as good of treatments, one of the multitude of reasons. And so when you have some of these products that you've gotten an IND for, and you've maybe spent $2 or $3 million to get your IND, you're not going in and getting a new, younger, healthier cell line. You're just going to keep replicating that cell line, even though this is starting to happen and you're starting to get, and that's why some of these products started out really good a few years ago. And then as the years go on, yeah, their name gets more well-known, but it's the same cell line from before. So where are they getting all of
That's
the,
insane.
yeah. So that's something that people don't talk about, and these companies are making millions and millions of dollars. They have the money to do it. They just choose not to, right? Because otherwise it costs them a few $1,000,000 again.
Hence why we have a government agency to oversee that.
I mean, if I do believe that there is a
Jeff,
good,
the local sheriff's department's not going to do it.
yeah,
The state patrol's not going to do it.
yep,
Okay.
No.
You've got to
Yeah.
have something in place. And that's the rub that comes with government agencies sometimes. I realize they're not, what we all want to have all the time. But the fact is you got to have a process in place.
Well, it's kind of like, so I don't think most people, there's this big, huge wave of trust the science, right, over the last few years. And that sounds really good to somebody that doesn't understand science. As somebody that has employed at least half a dozen, if not close to a dozen PhDs now that are scientists, I'm telling you what PhD scientists that are very good in their field say is they say, I don't trust that scientist until I replicate it, because scientists lie so much. And so part of the problem that I also see in the industry, you're 100% right. The local sheriff's not going to do it. We do need an agency to be on top of this. The problem is when the majority of the funding for, say, the NIH comes from big pharma, 47% of funding comes from big pharma. So then they control a lot of what's being done in the industry, which is more geared towards selling you a pill that you need every day. And I won't jump on this soapbox too much, but there's way more money in the treatment than there is in a cure. So it's not in their best interest how many of your viewers know that there's been a cure for AIDS that's been out for years, right?
Yeah, I want to be careful about going down that rabbit hole because it's a definite rabbit hole. There's no two ways about it. But what we've learned is that, listen, there's this really interesting treatment out there of using biologics, whether it be PRP or stem cells or exosomes. We know that, and it can do some amazing things. We're seeing the application of it at several layers. Right now, there's a bit of a mismatch between regulatory groups and providers. Providers, rather than dealing with the regulation in this country, have chosen to go out of the country, whether it's to Mexico or Costa Rica or Panama or someplace that have lower regulatory standards. And oh, by the way, the ones that choose not to follow the standards in this country have made some people very ill.
Correct.
And those that don't have standards overseas have also made some people very ill. We don't hear those stories. We just hear the great, the
Yeah.
goods and the greats. We don't hear the bads. And I think that's what's important about this as we work our way through this topic. And again, we talk on this podcast about evidence. What is evidence? How
Yeah.
can systems do it? And I think we live in a really unique time right now of seeing some transition, seeing some things.
Yeah.
So rarely is the pendulum at one side or the other. It's usually moving, and that's a good thing.
Yeah.
So as we take a look at it, if someone's looking for like a checklist, and I don't know, maybe we should work on putting together a checklist that our listeners can ask about. If I'm looking for a stem cell provider, what are questions I should ask? What should I ask them about? Where do they get their cells from? How do they process it? How do they do this? What all should be on someone's checklist as they start to explore this?
So I think it's important to separate stem cells from exosomes first because there are some overlapping analysis. So just on the very basic, right? What does FDA require? And while I will say there's a few good places international in Mexico, in Colombia and Costa Rica, there's also a lot of snake oil salesmen there. There's a lot of counterfeit products. There's a lot of stuff going on with Muse cells right now where they're counterfeit and they're basically being smuggled in. I used to joke that I don't trust the water in Mexico. I don't know that I'm going to trust the stem cells because and I've been in Latin America for 17 years now, right? My children don't even speak English. So I love the Latin culture, nothing against Latin America, but the simple fact is a lot of them don't even have access to certain ingredients that you need to grow the cells. Back to your listeners, I would say the base for all of this is if it's being injected into your body, there's something called an endotoxin test, right? That has a specific limit, right? There's mycoplasma tests, and then there's a sterility test. So those three at the minimum should be tested. And those should be across both exosomes and stem cells.
Should the supplier be able to show me, here is the endotoxin test on this product? Here is the sterility. Is that evidence I should be able to ask for and
100%.
view?
No question.
Okay.
If they do not have it, then there's a problem.
Okay.
Yes.
Very good.
That should be and then there's certain markers, right? There's certain markers for exosomes, right? CD63, CD81, right? I mean, you have and these are just markers that tell you what it is. They tell you that it is an exosome. So they're markers on the outside of the exosome or markers on the outside of the cell. So that guarantees what they are. Some of the stuff believe it or not, that is part of the problem with the industry is that it is very difficult. I'm actually working with a group right now, AASCM, and they're trying to come out and start being more of a watchdog, more as being a regulatory side, because some of these other stem cell associations, right? They're owned by people that own stem cell companies. And so what do? They certify their own cells and then they
It's
run their
just
own
a guerrilla
programs.
marketing tactic.
It's just guerrilla marketing tactics. So of course they're going to say
Yeah.
that their cells are good. So I think that one of the things that's missing is more of, I think the stem cell industry needs to come together. The good ones in the industry need to come together and need to start saying, these are the people that are doing bad and these are the people that are doing good. But from a patient standpoint, you should definitely, no matter what, you should see those three. If you're talking about stem cells, something that is very important is what's called a post-thaw viability. How many cells are actually alive after you've thawed them?
And a good physician should have the equipment in their office to be able to answer that question.
No, very few physicians would have that. That's called a cell counter. I only know of one person actually in the state of Florida that actually has a cell counter that will test cells. So it's not a super expensive machine, but I think it runs around 20,000, maybe a little less, that you can get a machine like that. So most people aren't gonna buy that. But that's why I think we need an independent association that would start doing independent tests, getting people's different products, testing them. So then we do have a place that you could actually point to and say, this is the place that actually that is doing independent testing on the product. And then it will give people, because it's very difficult, right? You need very specialized equipment to know um, how good of a quality you sell it. You can get some inference. So, for example, I saw somebody's post-thaw viability recently. They had a 72% post-thaw viability, which means 72% of the cells were alive after they thawed. I don't think I've ever had below a 95. Right now, that is very, very high. Your kind of gold standard is around 80. If people are really good, they can get into their 90s, right? But
What
something
determines
at
the viability?
72, because it's sort of like the weakest link, right? You either don't know what you're doing with the cryoprotectant, or you're expanding the cells out so much that you have a bunch of really weak cells, so they can't survive the freezing and thawing cycle. And then when that
So
happens,
Jeff,
you get more
I don't want to
information.
move off that. I want to go back to this real
Okay.
quick.
Yeah.
So, get a recommendation that some condition I have would benefit from stem cells.
Yeah.
I called Jeff Turk. He said, I've got 3 people here in Costa Rica that you should go talk to. I go talk to and let's say I go talk to 6 and not just 3. I talk to your 3 and 3 more. How do I determine who's got 75% viability versus 95% viability versus 0? How do we select those docs?
So remember we spoke about the population doubling. It's like the age on a car. How many miles does it have, right? Does it have 300,000 miles, or does it have 50,000 miles, right? And so this is something that every single lab in the world studies. It is part of your tracking when you're growing cells, right? So I'm specifically talking about expanded cells, which is the majority of it. But also, if somebody's telling you that there's stem cells inside of Wharton's jelly, then they should have some analysis to show what
Exactly.
cells are in there.
And that maybe are they alive or not?
And are they alive or not? Because the short way to tell, and I'll just say there's only one company that I've found so far that actually has a cryopreservative. Cryopreservative just means it's an additive, like antifreeze. Maybe that's a bad example, right? But it basically protects the cells from when the water in there freezes from creating icicles that then pierce the cell and destroy the cell, right? Kill the cell, they lyse it, it opens it up. And so if you don't have a cryopreservative in, say, your Wharton's jelly, then you can bet that 98% around there are all dead. There's almost no live stem cells anymore, because you need to have a protectant around them. So with Wharton's jelly, if they're trying to say that there's stem cells in there, then there should be some test. If there's no preservative, then they're all dead, right?
Jeff, I have several friends that do stem cell work out in Southern California. And is it possible to get a stem cell supply that has not been frozen? Meaning, is it possible to have a relationship with your practice to a supplier so that cell it's essentially it's like getting a fresh heart or a fresh kidney?
So that is an amazing question, and I am so glad you asked it, because it is very worrisome. Is that a word? I don't know. It is very worrying or worrisome.
Right,
There you
go.
Somebody passed me one of these and they said, "Oh, we're selling live. Don't get frozen stem cells. We're only selling live cells." And I looked at the date, and today's May 7th. So we'll just pretend May 7th for a minute. And it looks date of harvest, May 7th, date of endotoxin, mycoplasma, and sterility, May 7th. Okay. Endotoxin and mycoplasma you can do in the same day. The proper sterility testing is a 2-week sterility testing. So this is what is proper for a drug biologic under HCTP 361, right? The regulations state that you should have a 2-week sterility testing. So if somebody's selling you something without having the proper 2-week sterility testing, that's a problem. But it's all sales sizzle. They're like, "Oh, ours are never frozen." The frozen or unfrozen, actually, believe it or not, when you do a proper post-thaw viability, you don't actually just test. If you do it properly, right? You don't just thaw the cells, see how many are alive, test it, right? The proper way to do it is you see how many are alive, you put them in cell culture, you test them again at 24 hours, and then you test them again at 72 hours. So you can see how many stay alive, not just how many are alive, right, immediately afterwards. So that is proper. Let's just say you have high 90 post-thaw viability, right? When you thaw cells, you're going to have a high 90% that are going to be really good cells. In effect, you're really killing off the weakest link, and then all their guts are coming out, and you're still getting the benefit of what was inside of that stem cell. But if you have too many dead, then the body starts attacking it because it sees the outer
Sure.
casing of the stem cell and attacks it. So it is very, I would run very far away from anybody that tried to tell me that they had, because there's no way to do full sterility testing.
Because bugs grow over time. That's the
Yeah.
challenge.
Because the bacteria, right? The bacteria will grow over time, and you're cutting corners. Okay. And my concern would always be, if you're cutting corners on sterility testing, then where else are you cutting corners?
Oh my God. Yeah.
How soon after extraction and culturing do they generally freeze those stem cells?
Immediately after harvest, because what happens is, as the founder, I'm speaking as a founder of a lab, right? And so as soon as you harvest those, and the proper way is actually using a controlled rate freezer. If somebody cares, in general, you'll do 1 degree a minute, right? That you lower the temperature, but you pull the cells out, you add a cryomedia, and then you immediately freeze. So very, very quickly, it's immediate. And then you should always test the final batch, right? And we can finish this, but I'd also like to go into exosomes whenever you guys are ready to shift topic, because stem cells are one thing, exosomes are also another. Yeah, you're immediately pulling them out and freezing them, just like when you pull them out, they should be used expeditiously once they start thawing in a clinician's office, because otherwise the cells can start dying.
Yeah.
So let's
Wow.
shift to exosomes.
Yeah,
Let's talk
let's shift
about
to
that, because it
exosome.
sounds to me like there's a lower level of complexity, that these are signaling molecules. They're not actually living cells.
For which one, sir?
For
Exosomes.
exosomes,
Yeah, correct.
which is probably has a lower complexity for keeping high quality. So let's talk about that a little bit.
Yeah.
The decision to use exosomes instead of stem cells, what
Yeah.
drives that decision?
It's going to be doctor dependent, but what I've seen with most doctors, right, is in general is how old the patient is and how severe the condition is. So, and I was one of the first people to kind of view this with doctors a couple years ago, where they would stack both of them. They work very well together. Exosomes tend to give a more potent initial punch because you're giving a concentrated dose of what the stem cell releases. Whereas if you put only the stem cell in, it can take weeks to feel some type of change, right? Relief in the case of some people. If you put exosomes in, but then it's much quicker. Stem cells, because they're the factory, they can do two things. They can differentiate, right? A lot of people have heard, if you do an IV of stem cells, they stick to the lungs. This is very true, but they still have a systemic effect on the body. But if you have something like COPD, you might want them to stick to the lungs. So a mesenchymal stem cell does have the ability to turn into, I can go as deep as you want, but we'll say they're multipotent cells. So part of the way that you prove that they're a stem cell, when you've pulled them out of culture and you can prove that they still have their youthful vigor and are able to, it's called a trilineage differentiation. So you take that cell and you turn it into 3 other types of cells, right? And so if they turns into those other 3 types of cells, then that is part of the way that that you have not only a good quality, but you actually have a multipotent stem cell, right? And so inside of your body, they do have the ability to turn into other cell types. So basically anything outside of your what's called hematopoietic stem cells, so your blood stem cells, anything outside of blood, in general, they can turn into. So bone, muscle, neural, lung, skin. And so if you put that in, and they can then turn into skin cells, or something really, really interesting. Some recent clinical trials came out that if you say you have a heart attack and you have fibrotic tissue, so scar tissue, that's all it means, scar tissue in the heart. Currently, if you ask a cardiologist, there's no way to turn heart scar tissue back into living tissue. But see, stem cells can actually pass their mitochondria over to fibrotic tissue and bring it back to life. Or it can go to that area and then do that paracrine signaling and signal the surrounding cells to start repairing and replicating. So that is one of the big positive things that stem cells can do themselves. Exosomes can do it, but a different, it's a different pathway, right? They would go in and be absorbed by that cell and then have your body produce more stem cells, which then could do it. So there's an additional step there.
And then when it comes to exosomes, I believe yes, it's something that people inject, but also there is a topical application of exosomes that are a lot of estheticians and med spas are now starting to use it. Is it viable at that level of application?
So it is. There is, again, the same amount of snake oil there's a lot of it in the cosmetic space. Anywhere that there is a lot of money, right? So the thing is I like to use the example of give a man a fish or teach a man to fish, right? And if I give you, let's say there's freeze-dried exosomes, right? Freeze-dried exosomes are called lyophilization. They're in a powder, right? Exosomes, and again, let me know if I'm going too technical, but the outside of an exosome, it's called a bilipid layer. So it's a fatty layer on the outside of the exosome, right? Think about it like a key in a lock, or maybe like your iPhone. Your iPhone's only going to let you into it because it recognizes your face. If you do something to your face, put on a Halloween costume or something, your phone's not going to recognize your face, right? And it's not going to let you into the phone. Those CD markers are like the keys on the outside of that exosome that allow the stem cell in your body to absorb it. Now, that is what is teaching a man to fish, right? Because you're changing the signaling of your stem cells to start acting younger, what we were talking about before. If you don't, let's say you have freeze-dried your exosomes, because everybody likes something that's room temperature stable, but you've actually ripped open that bilipid layer on the outside. So you're getting the inside of the exosomes that come out. That is giving a man a fish, because is it good for the skin? It still has peptides in it. It still has other proteins in it. There's still other growth factors in there and in what you froze, but you basically mask some of those CD markers on the outside of the exosomes. And that's why a freeze-dried product will never be as effective as, say, a live product, because you're damaging those CD markers, which is the lock and key that allows your cell allows that exosome to come into it in order to open up that instruction manual. So when you talk about cosmetic, are you applying something that is signaling the skin cells to act younger, right? Or are you applying something that is just giving a fish and making them feel younger and healthier and softer for a few weeks, as opposed to changing the signaling of your skin so that it starts signaling to be younger for months? So does that make sense?
Yeah. So then what are the best applications of exosomes?
So the best applications in a clinical or in a cosmetic sense?
Both.
Yeah. I mean, anywhere. So the younger you are, the better exosomes are going to work, right? If you have a tear or you have something, because you already have a lot of stem cells to treat. As you get older, again, not medical advice, just what I've seen from talking with a lot of doctors. As you get older, you have less stem cells to activate. So stem cells are better. So exosomes work really well, especially when you're young. They work really well. If you put them into a joint, they stay in a joint. If you put them into the bloodstream, they go throughout the body, right? And so they'll be absorbed throughout the body. If you put them into the skin layer, dermis, then they will in general stay inside of the. So what are the best? The best are the ones that are frozen. Now, unlike stem cells, you do not need to have a cryopreservative. Now, if you want to keep them stored at a lower temperature, say your normal freezer temperature, you can add that. So for example, we have that in our product so that it can be kept at -20. It doesn't need to be kept at these ultra low temperatures that you need to keep stem cells at. But when you actually have a live cell that's then frozen, when it wakes up, it is then live again, right? It's kind of like putting somebody like in the movies, right? You put them in a deep sleep. That's all you're doing, is you're putting them in a deep sleep. As opposed to, imagine if you took a body and you sucked all the moisture out of it, and then you expected that to turn back into a live human being again, right? It's not going to work the same way. And so the applications, you can't sell it that way, because if you do, then the FDA will say, okay, now you're making claims about making it younger. But the reality is that your body absorbing those exosomes is then teaching those cells how to be younger, as opposed to just giving them a one-off. But again, it goes back to a lot of clinicians like this, because then you have to come back all the time. So I would say this to your audience members: anything that says exosomes and is room temperature does not have living exosomes in it. Okay, it's really, really simple. Any of these cosmetics that you see doesn't mean they're not going to be beneficial for your skin. They're still going to have healthy things in them. They're still going to have potentially proteins and growth factors in there that are good for you, but you're not going to get the learning how to fish. You're only getting the fish. Again, I don't want to
Mm.
keep using that, but I hope it's a good example. But so that's one of the big differences. And so it works the same whether it's going into your skin, into your joints, or into your bloodstream.
Is there sort of like a red flag checklist for exosomes, much like for stem cells, or?
It would be, again, you would want, so exosomes are a little different, right? You would want to have those three: sterility, endo, myco, right? For sure. And then the other one that is common is you're going to hear all these, it became this thing where it's like, remember the old Austin Powers, $1 billion. Everybody wants to do this now with exosomes. They're like, oh, I have 1 trillion exosomes in my vial. To me, if I see somebody that says I have 5 trillion, that's actually a sign that they have really low quality product, my opinion. And I'll tell you why. If you freeze dry something, typically this happens with freeze dried applications or where the cells have, the exosomes have lysed and they've opened up and all of that stuff. So when you test it, there's something called an NTA analysis, nanocyte tracking. Now, there's a specific machine called an NTA nanocyte. I moved away from that machine because it overestimates your particles by 20%, proven clinically. A lot of people like that because then it shows that they have more in there. So if you look at this NTA, an exosome is 30 to 150 nanometers. If you have a bunch of particles in there at the small level, the example I like to use is cars. If I say I have 10 cars, and let's say you have 5 cars, but 3 of the cars you went and take and put in little pieces so that you can say I have 10,000 cars. You don't have 10,000 cars. You have 10,000 nuts and bolts and pieces of a car that actually broke apart. So somebody that actually has 5 cars actually has 5 working cars that actually can do something. This is very similar to what happens in the exosome industry, where they will freeze dry something, or they've just damaged the cells, or they've done ultracentrifugation, and then they have a bunch of small particles. So when you're testing them with an NTA, you will see a whole bunch of small particles in there. If you see that, that's the nuts and bolts, right? That's not whole cars. That is pieces of cars that have been damaged. So then they use that to try to say, oh, we have all of these. It's just not true. I encourage everybody, I'm like, ChatGPT lies all the time. Go ask ChatGPT. Ask good questions, you'll get a good answer, right? But it's just, you're not going to have 5 trillion. What they're talking about is what's called EVs, which are extracellular vesicles. And so like in my lab, when I send them out, I use what's called a Zeta view, uses multiple different color lasers. And then that way you have the most accurate, it's the most accurate in the world right now to see exactly how many you have that are actually true exosomes. So that's the other thing. If people are using huge numbers, then it's probably not true, right? If it's too good to be true, then it probably is.
Well,
So
they're
much to
using the
unpack.
numbers to get effectiveness, and that's the challenge.
And
Yeah.
and Don, if we go back, it is not, there's a huge difference between, and we haven't touched on this, but between 2D cells and 3D cells. The majority of the industry is growing stem cells. And remember, your exosomes are a direct relation of the parent cell. So if you have really strong parent cells, you're going to have very strong and higher concentration of what that cell releases. So 2D cells are in a 2D environment, which is not natural for your body. So they grow on a flat plate. So those cells go senescent faster and they don't put out the same quality or quantity of signaling, which is the exosomes and growth factors. When you grow in a 3D environment, and this is crucial, it so closely mimics the human body that the cell is basically much happier, right? Because it's not stuck in a 2D space. So it produces more. So that's another thing that's really important when you look at this industry is, are they 2D or are they 3D cells? And are they 2D or are they 3D exosomes?
That's
This is
perfect.
interesting. I have to tell you, after sitting here and talking about this for a little over an hour,
Ugh.
I'm not sure I'm any clearer than I was when I started.
Oh, I'm
Um,
sorry, then I'm doing a
so
terrible
let
job.
me ask you this question, Jeff. There's no doubt that this industry is here to stay. There's no
Yeah.
doubt that when either stem cells or exosomes are used appropriately, they're very beneficial tools for a medical professional.
Yes, sir.
I absolutely believe that. That's a truth. A second truth is that because of the environment, there are a lot of charlatans, and it's a buyer beware environment. whether you're working with a supplier that's domestic in the States or whether you're doing with someone that's international, it's still big time buyer beware.
Yep.
Jeff, what do you think this industry is going to look like in 5 years? What is going to change? What is going to evolve? How can the consumer have, I think of used cars and Carfax. Okay.
Yep.
It took us creating a central agency that gathers the report of car fixes and it goes with the car.
Yeah.
Or when I get my oil, I think my oil changes go to Carfax. Okay. How long until we have Carfax for stem cells?
So, I want to go back for just 1 second and then I'll address your point. One of the other things that we have not talked about, and I'll just make this brief, is blood cells, right? The only FDA approved treatment is actually cord blood for blood-borne diseases like leukemia, right? The thing is, and I know this amazing human being. She was saved by getting cord blood, and then it also killed her 4 or 5 years later, something called graft versus host disease. So something that I want to get out to people is a lot of people are selling cord blood because that's the only FDA approved. There is something called acute graft versus host disease that can come back 3, 4, 5 years later. This is a really important point for your listeners, and it's a shame it's at the very end maybe, but mesenchymal cells, when you put them in your body, they don't engraft. They don't become part of your body. They go in, they signal, and then they leave, right? So they're not changing your DNA. They're not doing any of that. Cord blood has T cells in it. They're naive, which means they're very young. So the body doesn't typically respond to have an immune rejection to them. But those T cells engraft in your body, okay? So they stay in your body forever. So your body can spontaneously choose to reject those cells. Okay. It's a very important point. And there are people out there. I was on a call, a friend of mine's business partner's son had autism, and they asked me to jump on a call and talk to this guy, Harvard trained professor, doctor, went to, worked at Mayo Clinic or Cleveland Clinic, amazing resume. Right. And he's talking about doing this treatment. I say, but there's a risk of graft versus host disease. Oh, well, no, we don't have issues with that. We haven't seen, but there's a risk of graft versus host disease. I think people should have the right to have the knowledge and go in with eyes wide open, right? And they're like, oh, but we've done, hundreds of treatments and we haven't had a problem. Yeah, but let's see what happens in 4 years or in 5 years, because you're engrafting in your body. And then your body at some point could just say, these cells aren't mine, right? And then it starts attacking and it could kill you. So I think that's really important. I'm happy to move forward, but I just thought of that. And I thought that's so important because so many people out here are pushing cord blood as if there's no danger whatsoever. And the reality is there's at least the potential, even if it's small.
Well, listen, if I need a kidney, I find someone who matches me, or else it's going to be a problem.
Blood match.
Yep. This is a tissue transfer, and this is what happens with these things. So again, let me go back to that question.
Yes,
what do you think this field looks like in 5 years? What would you hope it looks like in 5 years?
I've been watching the industry for a while. So I think that within 5 years, we are going to have the cure for aging. Okay. Genuinely do. You can roll back. We didn't jump into IPS maybe for a different cell, but I think the two things are going to happen. One, there's already biomarker testing. So we'll be able to tell that your heart is a little bit stressed and maybe the nerves in your body are stressed. So you do a testing on your blood, you find out what's wrong, and then we will make you cardiac cells or cardiac exosomes most likely. So then, you have a predisposition for a heart attack and you're showing some markers in your blood for having some cardiac issues. You're going to get customized stem cells. I think it's going to go down to customized cells and more likely customized exosomes. So you have a broken bone, you're going to get osteoblasts, bone cells.
You think we'll have that in 5 years?
Well, we have that now. We've made those before.
Okay.
But again, it's going to be out to the market. I mean, there's a lot of cures for cancer, stage 3, stage 4 cancers right now that are being, in my opinion, suppressed because there's so much money in the cancer treatments, right? I know doctors that are curing people with stage 3, stage 4 cancer. So I think all of that, I think we're going to live longer, healthier quality of life. It's going to be able to maintain our youthfulness. And then we're going to be able to speed up healing and probably live as long as we'd like. I think there's that point within the next 5 to 10 years.
That's a strong
There's a
prediction.
Ray Kurzweil, I believe, is the one that says, if you live 5 years, you're going to live 10 years. And if you live 10 years, you're going to live 20 years. And if you live 20 years, so all you have to do for your audience, stay alive
Yeah.
for the next 5 years is what I'd say.
He calls that longevity is escape velocity.
That's correct.
Right. Yeah.
And yes, I agree. You know what? I just finished reading an amazing book with Peter Diamandis and Stephen Kotler called We Are
Yeah.
as Gods, talking about AI's application. I think that's going to integrate on this. But at the same time, we've got to have, I just had a very good friend pass away from pancreatic cancer.
Yeah.
And when he told me he was ill, I went to some of my great docs that I know and I said, what would you do? Recommend? And they said, well, I've got this clinic down in Mexico. I would create alone and I would go down. He didn't and he passed. Now, there's a lot of people that go to these clinics and there's problems too. So again, we're
Yeah.
only hearing the good side. We're not hearing
Right.
the bad side. And I think that's what your mission is to make sure we understand both sides of this equation, because that's what's so important.
Correct. My father also passed away of cancer. So I have delved into this very deeply. I know who you're talking about in Mexico. I believe that the good one anyways, right? And they're using what's called a dendritic cell vaccine in order to do that. You can also co-culture NK cells. People are using T cells, but that has its own issues, right? Where a lot of people are more sick from the T cells than they
Yeah.
are. I do think that just to your point, there's lung cancer, there's two types of breast cancer for women, pancreatic cancer, right? And prostate cancer for men. Those are kind of the most common ones where I believe we will. And I'm hoping that I'll be involved in this moving forward with some of these FDA, but I think we're going to have off the shelf treatments for those. So if you can create what's called a CAR-NK, a chimeric antigen receptor, but it can target the specific proteins in that cancer. So then you can have an allogeneic, so an off the shelf treatment, probably of the exosomes, right? Where you get the exosomes that came from that NK cell that will then go in and boost your own NK cells. So then you're naturally going after that cancer. And I think that and a couple of other technologies work really well together with stem cells.
Well, as we close up, for our audience, there's a couple things I want everybody to remember. One thing that we know works to make you healthy or extend health span, not necessarily expand lifespan, but if you exercise, okay,
Correct.
that costs
Yes.
nothing. It works on everybody. What
Mm.
we know is that if you consume a diet that's rich in nutrient dense foods, not highly processed foods, whether it's from an animal or from a plant, it depends on the individual. We know that is beneficial. And then you can hack that with supplementation. We know that when you get enough sleep and you tune your circadian cycle, we know that makes you healthier and lowers disease state. And we know that light's a big part of that. But this was the point that came out of the book that Claudia, I haven't talked to you about this, but literally the term purpose.
Yes.
Okay. Your ability to wake up every day and they do a great talk in the book about how about a populations growing that are completely supported but without purpose, and it's not a good thing. You have to have purpose.
Yeah.
And I think that when you do these things, the last thing, and Claudia, I haven't decided if I'm going to make this a rock yet or not, but community. I think community is
Absolutely.
so.
I mean,
I
you
don't.
can't out supplement or out stem cell, out do
No.
any of that. Like if you
And
have,
Don, I'll
Yeah.
throw this, when you asked about the right doctor, some of the best doctors that I know are some of the naturopaths or osteopaths that
I
actually
agree.
look at it. So I would say you're 100% right. Like I'm around a lot of the longevity space. And as you said, having a purpose, having a mission, reason to get up is so tied. But
It's
then
critical.
you're exercising your diet. And guess what? If your doctor just doesn't ask you, what do you eat and what do you put in your mouth, right? And doesn't ask how you sleep, then that we know, you, me, Claudia, a lot of other people realize that is more important than even the stem cells or the exosomes, right?
They're treating symptoms. They're not treating the organism.
Correct.
And I think this is what's so important. So listen, I think this is important to have these conversations along the way. So Jeff, thank
Yeah.
you so much
thank
for
you.
coming on board. If
Thank you.
someone wants to learn more about you, what you do, where you do it, how do they find Jeff Turk and get more information?
Yeah, well, until we get this regulatory aspect claim, it's the same technology. I just chose to go down cosmetic route. So my company is called Mount Hydra.us. right? Mount Hydra. And, I genuinely got into this to heal people. So if anybody actually needs anything and they have a question for me, I'm quite busy, but I always take time out. I mean, what is the point of us as human beings if we can't, if I could take a couple minutes out of my life to help somebody out, I'm more than happy to do that. So my email is jeff@mounthydra.com. Right.
Good.
And
Yeah.
happy to talk to anybody if they need any opinions or anything. I am in this to help heal people. I think that is a future. So right now it's cosmetic.
Well, and so the challenge there is if you're watching this, you'll notice that Claudia does not need cosmetic work, and I'm way beyond the pale. So,
And I turn
you
50
gotta be
next year. So if I
all right.
shave my beard, I look like a kid. I have to grow a little bit so people take me seriously.
Yeah, I get that too. I hear that too, but and I've got a few years on you, but I don't think that's where it's going. But um,
Yeah.
Jeff, thanks a lot for your
Thank you.
time. I do think we've got to figure out how, because I've just been Googling here. What is a checklist? What's a tool that
Yeah.
if you think, when should you explore biologics, stem cell, PRP, any of the
Exosomes.
biologics? When I think that'd be a good question. Number two is how do you select the right practitioner? When do
Yeah.
you stay domestic? When do you go outside the border? What are the benefits? It seems to me like this might be a really interesting tool for a company like yours, and maybe we can help you put that together.
And Don, actually, that is one of the things that I'm working on because I don't have a dog in the fight, but I'm very familiar with the dogs in the fight, right?
Yeah,
And so that's kind of my point. Is I said, how do I give back to the industry right now? Like it generally was what healed me and helped me, and I think other people deserve that healing at affordable pricing, like we talked about before. How do we democratize access? And how do we work with doctors? So I am actually trying to put together, and I'm happy to work with you guys, and maybe we can get together other good groups like yourselves and a few other ones to say, here's an association that is actually neutral and will actually put together a group of doctors that are actually doing good, care about their patients, and actually care about the product they're putting in their patients. So would be happy to put
Yeah.
together that checklist with you guys.
yeah.
Happy to look at how we can help. Rising tides raises all boats, and how we can help out the industry itself and get healing to people.
Jeff, you said you're a
Indeed.
veteran,
Yes, sir.
Air Force, Army, Marine.
I've had continuous military service all the way back to the Revolutionary War in my family. So I'm the only guy that went to the Army. My family was all Air Force and
Really?
Navy. Yeah, it's a long story behind that. I won't, but I was a nuclear biological chemical operations specialist. I actually was around, got to play with nerve agent in the military. So
Wow.
I know my space around this. I was actually the head NBC NCO for a medical unit down in Sarasota, Florida. So I did all their training and stuff. So I have been around this for a bit longer than just some
Well,
random guy that jumped into this, right?
thank
Yeah.
you. Thank you for your service.
Thanks
We
so
really
much for
appreciate it.
all of it.
Yeah, I learned to
Yeah.
thank people for paying their taxes when they say thanks to your service. So,
There you
no,
go.
thank you. It beat up my body like most veterans. In fact, I do a lot of work with veterans, helping them out as well. So, also happy to. I have a nonprofit called Stem Cells with Love as well. That
Oh,
we
nice.
we try to
Love
help out
that.
people that can't afford treatments and things like that. So I just
Amazing.
connect them to doctors that are good.
That's an interesting point. Maybe, and Claudia, this might be a great topic sometime. But
Yeah.
I had a nephew that was a naval special operator. I know, I have very good friends that have been very elite warriors, and we beat the thunder
Yeah,
out of you people. And our veterans pay. It's not like they went to summer camp for 4 years. I
yeah.
mean, they get the daylights whooped out of them, and they pay a price. And I'm not sure we're doing a good job of supporting you after the fact.
Certainly
We're
not.
spending far too much money on missiles and not enough on veterans, but that would be my personal statement at this point.
Yeah.
From a veteran standpoint, I agree 100%. I help get veterans a lot of treatments. I think that a lot of veterans, myself included, people thought maybe I was an alcoholic for a while. I wasn't. You're just in pain all the time. So you start self-medicating, right? And it's
Well,
just giving that relief.
and traumatic stress, just the aggregation of traumatic stress. I Listen, one of my products is called Mode and Method. It's a CBD
Oh, yeah.
cannabinoid combination with omega 3s that we have a very particular veteran following with that product because it gives them the ability to get off of some of the other nerve agents
Yeah.
they've been talking about, they've been using. And so I think there's lots of natural natural cures or natural
Treatment.
support,
Yeah.
treatment for these things, and
Yeah.
we've got to be willing to explore them. That's the
Yeah.
other important point.
And you know, I actually was in the CBD space. I was one of the first movers in that space many years ago
Yeah,
because of the same thing, right? It helps with reducing inflammation, helps with healing, helps all sorts of things, neurological, CBG, CBN, helps for cancer, all
we
these things.
have an endocannabinoid system. We have an entire nervous
Correct.
system
Correct.
that works on those
Yeah,
molecules.
yeah.
That's what we know now.
Only designed to respond
Yeah.
to, you know, we'll go down that topic
Right.
sometime in the future, but that's
Yeah.
why I think a lot of these pair well, right? There's no one answer. It's a combination of your health, you working out, what you put in your body, where your mind is at, right? What you focused on,
Mhm.
and then other things, you know, these all helps. I'm a big fan of natural. Whatever is the most natural is probably going to work better than, and to your credit,
At
CBD,
least
I
try
think
it
they
first.
say,
At least try it first.
yeah,
Then, if it doesn't work, then go to the extended molecules.
correct. I would agree with that 100%, Don. And
Yeah.
thank you again. You guys have been amazing, and thank you very much for being my first podcast. I really appreciate
Well, thank
you guys. You
you
never
for
forget
taking
your
the
first,
time.
right? So
Yeah.
I am keeping
Forever
my
mark.
mouth shut because there's so many inappropriate things I could say, and I'll wind up at HR.
it was the
Thank you
best I
so
could
much,
Thanks,
do.
Jeff.
everyone.
Thank
This
you
is
so
great.
much. Have a wonderful afternoon, guys. Bye bye.